They really don't.
I my phone battery died. Yeah, my phone battery died literally.
Okay, folks, a couple of announcements, just in case you can't figure out Seabase, because I can't. Today, tomorrow, and Wednesday, we will be here. Friday, you know, there was a swap with the biochem course. So we will have a lecture at 10 a.m. up in the anatomy seminar room, because this place is booked, at 10 o'clock. And then there's no lab or anything after that. You have your OSCE or whatever in the afternoon. And next Monday, I guess you have your final in that course. And so there will be no lab. Obviously, there'll be no course here. One thing well, and then 2 weeks from today, there's your final in this course. Let's see here. So a week from, a week from today, Monday, there is no class. There is a class on Tuesday when we will dissect the ear. Wednesday is a review day. And Friday is a review day, although I haven't been able to write anything on the Friday entry for some reason. It tells me I don't have permission, but it says there's a class on Friday. But when I try to type anything in, it says, why do you want to do this? And I couldn't come up with a good reason, so I said the class needs it, and they didn't accept that. So realize there's a review day listed on Seabase on 2 weeks from Wednesday, and then there is another. A week from Wednesday, but then there's another review on Friday, even though it doesn't say that when you log in. Okay, so today this is sort of a double lecture. It's an overview. We're going to talk about the oral cavity, the whole mouth, basically. Today's dissection is hard and soft palates, and then tomorrow's dissection is basically everything below that, the tongue and the submandibular region under the tongue and all the muscles going to and from the tongue and the salivary glands there. So today's lecture basically covers today's dissection and tomorrow's dissection. Tomorrow's lecture will be on parasympathetics, our old friend. So I'm covering the dissection material today, and like I say, this will include tomorrow's dissection. Okay. So here's what we're trying to cover today, just an overview of all the terminology, a lot of which you saw a preview of in Dr. Kassim's wonderful lecture last week. Hard and soft palate, which, like I say, is today's dissection, blood supply and innervation to that region, and the various muscles. Then we're going to talk about salivary glands, muscles in the submandibular region. You've seen a lot of those earlier in the neck dissections. And then all the different muscles of the tongue coming from all different directions, both internal and external. Okie doke. So let's start with an overview and sort of what's where. This is the same diagram we've talked about before. We have a nasal cavity where air comes in. You have the mouth, which is the oral cavity. A few tonsils here and there, these hatch things. The tongue at the bottom of the oral cavity. The hard palate and soft palate, this is what we're going to be talking about today. These are the structures that separate the nasal cavity from the oral cavity. And obviously behind the nasal cavity is the nasopharynx. Behind the oral cavity is the oropharynx. And then there's laryngopharynx, which is behind the larynx. And that'll be Wednesday's dissection. Okay. Here are the structures in cross section at a gross sense. So here's the nasal cavity, which you dissected last week. And here's the pharynx, the nasopharynx, the oropharynx, and the laryngopharynx down here. Here's the hard palate, made up of two bones, the maxilla and the palatine, followed by the soft palate, just made up of muscles. Here's the oral cavity, basically the mouth, largely filled by the tongue. Okay, going back into the oropharynx, and then down here's the larynx. So this is what we're going to be talking. We're talking about all of this today, but today's dissection will involve this upper part. Tomorrow's dissection involves the lower part. Okay, so in the way things are supposed to work is obviously you eat food, it goes into your mouth, you chew it up, you swallow it, it goes down the pharynx back here into the esophagus and into the digestive system. What you don't want to happen, that's what's supposed to happen. You don't want it to go into the trachea. You don't want to end up with food in your lungs. It's not good for breathing. And you also don't want it to go up your nose. And there are various mechanisms to try to encourage food not to go into your larynx and not to go into your nose. Again, we'll talk about this one, which is basically your epiglottis, on Wednesday. What we'll talk about today is why food doesn't go up your nose, or shouldn't go up your nose, and that's what the soft palate's all about, and all the muscles that make the soft palate block any food that's coming up in that direction. Okay, so here's a person saying ah, and the vestibule basically is the space that's inside the lips and cheek, but outside the teeth and gums. So it's the area on the outside of your teeth and outside of your teeth, on the sides and in the front and upper part. If you're so inclined, you can stick your finger in your mouth and feel where the vestibule is. Okay, there's a tongue, there's that uvula. This is the soft palate. This is what we're going to be talking about a lot today. We're going to be dissecting. If you recall, we mentioned the other day in overview that there's a couple of arches down here coming from the soft palate down. This is the palatoglossal arch. So it goes from the soft palate down to the tongue. There's the palatine tonsil in between, which may or may not be present in your dissection. And then behind that is another arch, the palatopharyngeal arch. So you should have seen those in the dissections last week, and today you're going to be dissecting this area out. Like I said, that's the soft palate with the uvula dangling down. Okay, so that's sort of the orientation. That's the area that today's dissection is going to be largely concerned with. Okay, so hard and soft palate. There's our nasal cavity, the maxilla, the palatine bone. Those make up the hard palate, the hard part of it. Then there's a whole mess of glands, these palatine glands, in the underside of this, okay, the roof of the mouth. There's a little connective tissue down here called the palatine aponeurosis that sort of is between the bony part, the hard palate, and the soft part, the soft palate. And then there's all these muscles that make up the soft palate in the back. And the part that you see dangling down in the midline is the uvula. So these are the structures basically that are separating the nasal cavity up here from the oral cavity down there. Okay, here's another picture where we have opened up the back of the nasal cavity. So we pull these inferior and middle conchae away and sort of chipped away a little bone here so that you can see these nerves and these arteries coming down and providing blood supply and innervation to the underside of the the tissues lining the hard and soft palate. So this big one up front are the greater palatine artery and nerve, and they extend forward and supply innervation and blood supply to the part of the palate that's basically beneath the maxilla, or the whole area of the hard palate. So the greater palatine comes forward all the way up here. The lesser palatine nerves and arteries extend posteriorly, and they supply the soft palate. Okay, so they come down in this canal that you'll see in the course of today's dissection, and when they get into the underside of the hard and soft palate, the greater palatine nerves and artery head forward, lesser palatine head backward. And you'll chip away the inside of the nasal cavity and can actually see these coming down. So here's what the palate looks like from the underside. Here's what you see. You see the tissue here with these little holes in it. Beneath that tissue is a whole series of palatine glands, which secrete mucus, like most of the glands in this part of the body. And their secretion sort of open into the oral cavity through these little bitty ducts that if you look very closely you can see on the underside of the palate. Okay, here is basically what we saw before in side view. So here's the underside of the palate again. Here's the greater palatine nerve and greater palatine artery with it, coming out and extending forward to supply innervation and blood supply to the bony part, the hard palate, the bony part of the palate. Comes out in the gap. These nerves come out at about between the second and third molars, for those people who have third molars. The lesser palatine nerves and arteries come out right just behind that, and they head posteriorly to supply the soft palate. So when you dissect this away, you'll see instead of nerves and vessels running forward, those are the greater palatine nerves and arteries, another set going posteriorly. And then there's, in the front, coming through this incisive foramen here, is a nasopalatine nerve that traveled down the nasal septum and then goes from the nasal septum into the oral cavity, basically the front part of the palate. So the nasopalatine nerve supplies this front end of the palate, and anastomosis with the greater palatine coming forward. And there's also the last gasps of the sphenopalatine artery supplying blood supply to this front part. And these nerves and arteries anastomose with the greater palatine nerves and arteries coming in from the back. And Dr. Cassine talked about the problems of getting innervation to the palate because you've got these two sources, the overlap between them. Okay, so here we have another view. Okay, the same stuff, the hard palate here, the soft palate there, nasal cavity above, oral cavity below. You remember there was in the back of the nasopharynx, there's a tonsil here, usually referred to as the adenoids. Okay, here is the opening to the eustachian tube. So that dark area there is the opening with this arch over the top of it, referred to as the torus tuberous. And it's bounded by two arches. The salpingo-palatal arch, which sort of goes up towards the palate, from the tube, around the tube, salpingo means tube, around the tube going into the palate, and then behind there's the salpingo-pharyngeal arch, wrapping from the top of the tube down into the pharynx. And then here's the soft palate back in the same area. Okay, now the other series of arches, remember surrounding the tonsils back here is the palatoglossal arch, goes from the soft palate into the base of the tongue over here on the side. And then in the middle is the palatine tonsil, and in the back, the palatopharyngeal arch. So there's a whole series of arches here in the back of the nasal cavity and the oral cavity that are named basically by where they're going to. So the salpingopharyngeal arch goes from the tube, salpingo, the eustachian tube, into the pharynx. The palatoglossal arch goes from the soft palate to the tongue. The palatopharyngeal arch goes from the soft palate to the pharynx. And in this case, they're surrounding the eustachian tube. In this case, these arches are surrounding the palatine tonsil. And then way down there, we have the epiglottis. Okay. So most of these arches, okay, except for one here, have muscles underneath them. Okay, so this salpingopharyngeal fold overlies a muscle of the same name. Likewise, the palatoglossal arch overlies a muscle that's underneath it, and the palatopharyngeal arch overlies a muscle that's underneath that. So it's pretty easy if you remember one to figure out the other. And then in the back of the pharynx, you have the constrictors. Okay? Then there are some other muscles that are responsible for moving the soft palate. So you've got this soft palate dangling down right in the back of your oral cavity, which is fine. I mean, you know, it's sort of attractive in a sort of funny sort of way. The problem is, when you send food in here, you want that food to be forced down into the esophagus, not to slide back up and go out your nose. So you want to basically make this soft palate a firm structure, that it can, instead of just dangling there in the middle,